What is earFold and how is it done?
Oh, I've done this one before. Okay, earFold. earFold is a method of correcting prominent ears. It is a little metal clip, and it's a little curved metal clip. But when it's given to us as surgeons, sterile, it is straight. So what we do is we work out where we would need to clip your ear along this crease, along this fold, in order to correct prominent ears, if it indeed will work in your case of prominent ears, and sometimes it doesn't. And then during surgery, if it will work, I can make a little cut, I can dissect a little tunnel to the fold, I can then I can winkle on this applicator, this little clip, and then remove the applicator. And as I remove the applicator, it reverts to its curved shape, prominent ears corrected. You can do it as an outpatient procedure in the clinic. It turns a 45-minute operation into a struggling to make it last 5 minutes operation, and it's permanent. It's a permanent correction. It's a really neat way of doing it. You don't need the great big head bandage afterwards. There's a very, 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 very low risk of it recurring, so it's a nice way of doing it if it's appropriate.
Lots of people, when they're interested in earFold, they ask, can you see the clip once it's in your ear?
Yeah, so that's a risk. So generally, no, not usually, but it can happen. And I have certainly encountered cases where you can see the edges of where because it's such thin skin there's not a lot of padding around your ears, right? So you can sometimes see a step off where that happens. There's a couple of ways to try and avoid that. You can go underneath the ear cartilage lining to really keep it snugged against the ear. Another thing that can cause it actually is infection. Is infection. So the earfolds seem more, surprisingly, and this flies in the face of what we know about infections, but seem more resilient to exposure and contamination than other kinds of implants would be. But one thing that can happen is it can sit more proud, it can lift forwards. And in those cases, yeah, you've got more chance of seeing it. And if that were to happen, then one way of managing that is actually just live with it for a year if you can, and then have it removed in a year's time, and your ear is likely to maintain its correction at that stage. It appears that if the ear has been held back for that length of time, the cartilage remolds, and you then don't need the earfold. The longer the better, so you've got some risk at 1 year, less risk at 2 years, very little risk at 5 years, etc., etc.
I think, I was just going to add that I think the people we have encountered using earFold, if ever they have been able to notice the little step, they are more happy to accept this slight visibility than the prominent ears. They're more happy that the ears are sitting in a better position.
Yeah, I have to say, I look for the step, and I can't always find it. And when I do, and I say, there's a little step there, I say, I don't care at all. I'm not bothered. So it's remarkably, it does not perturb people compared to the ear prominence that they just look in the mirror and they see that every moment of the day.